getting started here. Gonna give a couple minutes for people to log on to the Facebook Live. And Brittany's just getting set up. So we're gonna give a few minutes for people to come on, maybe 1 or 2 minutes, and then we'll get started. The live demonstration that we are starting now is going to be a lip filler. And I want to make sure that everybody knows what we're doing with this particular patient, and maybe even our patient will kind of pipe in a little bit. So before we actually start injecting, let's talk a little bit about the patient's goals, where we're starting from. And do you mind if we do a close-up of where we're starting? Okay. So this is Kayla, and she already has, as you can tell, really pretty lips. And there's a reason for that, because Brittany,
she has had 1 syringe of filler so far, but she is wanting to build up to more voluptuous lips and increase her vertical height. So we are going to be adding another syringe in to go ahead and give her that plump in the shape that she's looking for.
Okay. Kayla, tell us what, if you don't mind, what do you need a mirror, or you know what?
No,
you
I kind of know.
Okay, so what are you trying to do?
My Cupid's bow, because I have like nothing right there, so I'm just trying to build that up with the Ultra Plus, and then just bring down my palette just a tiny bit more. So
okay. So this is a second step that we're doing today.
Yes.
Mm-hmm. It's
Second
like
step?
an upgrade.
Okay.
Yeah.
So definitely an enhancement.
So one thing I want everybody to remember when it comes to lip filler, especially if you're starting from smaller lips, is you can't just put 1 syringe in all at one time. It does take a little bit of time to build up to your lip goals depending on what they are. With Kayla, she's wanting a lot more voluptuous lips on top of a better Cupid's bow and the increased height. So it is kind of a step process. So like I said, we're now starting her 2nd syringe, and we're going to be able to build those lips up to give her exactly what she's looking for.
Okay. Awesome. I'm going to see if I can find somewhere to stand where I'm not in the way. So you're good. So for those of you that are signing on now, feel free to ask questions, and you can drop those in the comment box there as we're going along, and either I or Brittany will answer the questions as we go. Obviously, you can watch this back on replay, and if you have questions at that time, same thing, put it in the comment box, and we will respond to those as quickly as we can. So this is day 4, I think, of our live demonstration week. We've done all kinds of demonstrations on actual treatments, the things that are most popular here at Pura Vida. I think lip filler is exploding in popularity right now. I think just across the country, but I can tell you in Fleming Island, Brittany's put her mark on Fleming Island, and she's becoming very popular with her lips. She's beautiful before and afters, so if you haven't seen those, check out the social media pages. You'll see them. Follow Brittany's personal page as well. We're often tagging her there so you can find her work, but we always share it on Pura Vida page also. So at the end of this session, just like we've done with all of the other sessions as well, we're going to be giving out a discount code, and that discount code will entitle to anyone who's watching a discount on any of the services that we've done in live demonstrations this week. So feel free to go back and look at the videos we've done earlier in the week, and looks like we are about to get started. So I'm gonna stop narrating and let these girls go at it. Of course, Kayla has already had her topical numbing cream on, which is certainly a requirement for this treatment. So I will turn it over to Miss Brittany.
So there's a couple different techniques that you can use when it comes to lip filler. For her particular goals, and she's wanting to increase the vertical height, I'm actually going to be going in the vertical direction through the vermilion border to kind of help lift up that lip. I'll also be going in horizontally, which you'll see. So I actually transferred some of the filler into a smaller syringe, since I'm going to be injecting a lot more times going through that border. So initially, I'm going to start with the top lip. And the technique that's used, there's a few different names for it. Tinting is one of them. So I like to measure, and then I go ahead and let my patient know they're gonna feel a little prick. This area is a little bit more sensitive. So you go in more superficially
and you're actually lifting the lip up as you draw out.
Can you guys see that good enough from there? Okay, so for those that are here watching live, feel free to sneak up here because it's very fine what she's doing. When you up close, you can really see it.
But it's actually pulling the lip up. It is a little bit more pinchy. Kayla agrees. The border can bleed a little bit more than normal. Little poke.
This is one of those treatments that it's so worth it once it's done. In the moment, maybe not so much, but.
She said pain is beauty, if y'all couldn't hear her. And you can expect some swelling. You're gonna have swelling just from the injections itself as well as the product. Everybody is different, but bruising and swelling is absolutely common. So I go ahead and pre-warn people, if they are wanting to get their lips done, don't do it right before a big event. If you have a wedding or you're going out of town, you want to at least do it 2 weeks before. It can take a total of 2 weeks for your filler to settle. So I try and pre-warn people that you do go through a healing stage when it comes to lip filler.
It's looking good.
And you'll be able to see as the height increases, as we do more through the border.
I like to do a close-up once we get, and maybe kind of be able to show the difference between our two sides here in a moment.
Yeah.
And this, oh, you're okay. I can give you a tissue if you need to.
It's just, you know.
It's like when you have a pimple close to your lip. It's a little pinchy.
It's not bad. It's just, you know, automatically. You just
Make sure
It's
eyes
a normal.
water.
It's a normal body
Yeah.
response for sure.
Absolutely. So,
Clumpy already.
and this particular injection is a little bit more superficial compared to some other techniques. Slide open of the mouth. So getting in the corners, I have them open the mouth just a little bit. And I apologize for the blood, you guys, but it's kind of part of it.
So one thing you also want to do in preparation, if you're going to do fillers anywhere, is don't do anything that's going to cause your blood to thin more than usual. So no alcohol, 48 hours in advance?
I
No
prefer
NSAIDs.
that.
So no NSAIDs, things like Motrin, Aleve, ibuprofen. Stay away from those kinds of things that'll thin your blood, because it will just cause you to bleed a little bit more during the procedure, but also if you bruise at all, it'll cause your bruising to be more pronounced. So.
And this technique, I mean, it's not used on every single patient. It really does depend what your goals are. If you're wanting to increase the vertical height, it is a more popular injection point. I'm gonna have to step a little bit where you are, sorry.
No problem.
And then slide open of the mouth. I'm actually going to tackle a little bit in the bottom. So once again, still doing the vertical route.
It's looking good.
It can actually go very quickly. I was going a little bit slower for you guys at first going through the border, but you can move much quicker. I just wanted you to be able to see the technique a little bit better.
So we have a question in the chat box here, which is always a good question, and we get this very frequently. How long do fillers last?
So that is a good question. It depends on a few different things. It can be on the filler that's used, and then I think the biggest thing that people need to understand, it can also be based on the person, their metabolism. If you're somebody that is very active and works out a lot and has a high metabolism, you may in fact process filler quicker than somebody else. I would say on average, anywhere from 6 to 12 months. I feel like a lot of patients, they actually get used to the filler and end up wanting a little bit of a touch up around 6 to 8 months, just because they want more volume. You get used to what your lips look like and it becomes the normal for you, and then you want a little bit more of a boost. So it just depends. You still doing okay, Kayla?
Mhm.
Okay.
I want to know if it's numbing cream is working.
Mm-hmm.
Yeah?
Just
You know?
little
Okay.
So the filler itself actually has lidocaine in it as well. So once you make some small threads, you get numbing inside the lip as well as the topical on the outside.
Oh, nice.
So once I go back into the area, it will be a lot more numb for her than the initial. I'm gonna turn your head slightly towards me.
I'm running out of arm length to stay out of
I'm
her
sorry.
way.
Do you want me to hold it
This
for
is
you?
professional photography right here.
Do you want me to hold it?
It's all right. I'm part of it keeping it close to her is they can hear her well when she's talking too.
You
If
know,
it's easier to stand on the other side, then that might work too. Because
Yeah.
I'm about to reach
All
out
right,
a little
I'm
bit
gonna
more.
go ahead and
I'm
move
so
around.
sorry.
Yep, you're good. I'm gonna go ahead and move around.
I'm actually gonna have to lose armrest.
Okay. Before you start her other side, though, I want to give a good close up for everybody here who's watching, including in the room, so everybody can take a look at the side by side.
I'm just adding a little bit more in the middle. So not getting quite to the other side yet.
Okay.
And this is going to be more for the height versus the volume. So we're going to go back in afterwards and actually add volume into the lip horizontally.
Question, is it reversible? Like, if
Yes, so the fillers are hyaluronic acid. So if for any reason that you are unhappy with the results, you have any type of reaction, which is extremely uncommon, then there is a product that we can use to dissolve the filler.
okay.
And that product is administered injection into the lips.
That's
And
awesome.
it starts dissolving within minutes. So I would massage the area, and then I would also have the patient continue to massage the area afterwards. There are things like filler migration. Filler can go in places that it shouldn't. That can be, oh, you're fine. That can be both injection technique, and it can also be post-care if you don't follow the instructions after having your fillers. When you're getting fillers done, we want you to avoid extreme exercising for the next 24 to 48 hours because you're gonna get your body hot. Any extreme heat, so hot tubs, pools, saunas, going to the beach. No manual manipulation. I don't want you moving around the filler. If you're able to sleep on your back the first night, it's preferred just because if you lay on your side, you can actually move the filler. So post-care instructions are super, super important. And that can be a reason why you may have to dissolve filler
Okay.
if they're not followed
So how
properly.
long do you take those cares?
I request the first 24 hours at
24.
least, but filler can take up to 2 weeks to settle, so you gotta be careful.
Oh, okay.
I don't want you using a straw for a week.
Oh.
Anything that you have to make your mouth form a pucker, I would like you to avoid for 2 weeks.
Gotcha.
So while you're continuing to inject, I'm going to answer a couple questions that
Sure.
came in. So we did have a question that had been answered, but I'll address it again because she may have joined later. How long do fillers last? So that is a little bit of a, it depends. The manufacturers say between 6 and 12 months. We've seen people go as long as 18 months. It depends a good bit on your own metabolism. So people who are, really hardcore workout, marathoners, things like that, they will burn through their filler faster. But you can expect at least 6 months. And Brittany also said a lot of times people feel like they want more filler at the 6-month mark, not so much because it's worn off or been metabolized, but because they've gotten used to how their lips look, and so they may want to actually enhance them a little bit further. And then, so tell us, Brittany, that was a different angle that you went in, and then I'm going to answer a second question after I let you explain that.
So I was actually going in directly into the vermilion border, and that's just to crisp out the border more. A lot of people really, really like a defined lip line. So by doing so, I'm able to give her that really crisp look. Now you will notice she has some swelling above her lip, and that is in fact swelling. It's not filler. So just with the type of injection technique that I'm using, you will have that little bit of swelling above your lip that will go down. You can use ice and even take arnica prior to coming in for injections to kind of help with bruising and swelling.
So we have a comment here from someone who is, I'm assuming, has had lip filler in the past. She said it hurts so bad. How does she not have tears streaming down her face? Well, we'll have to ask Kayla that when she can talk. But I will say this, one thing that Pura Vida invested in, and I'm proud that we did that, is we have a very strong numbing cream. It's very effective. We have heard many times from patients here that they've had things done elsewhere and it was much more painful than here. So we did invest in a quality numbing cream with an emulsion that transports really well. So we find that patients do better as a general rule of thumb for that reason. The other question that came into the chat box a little bit ago was, I think something along the lines of which filler is best for me. And that's definitely a question that can only be answered when you come in for a consultation with Brittany. She's going to evaluate your anatomy, talk with you about your goals, what you're trying to achieve. It is so very different for each person based on how their lips look and what the beginning state is. Some people have very thin lips. Some people have no shape. And so there's just so many variations there. So the fillers range based on the type of product that they are, the thickness, the amount of projection that they're going to give. So it really is a personal decision. We don't charge for consultations at Pura Vida for that very reason. We want people to come in and have a conversation and find out what's going to be the best option. And price is always an option. An issue for people. People want to know what it's going to cost. Unfortunately, we can't tell you that either until we know which filler is going to be best for you and how many syringes of filler is going to be needed. So that's always a difficult question. Kayla, would you mind sitting up for us just for 1 second? I just want to get a little bit of a close-up so you guys can see the sort of before and after, if you will. It would be her left side, which is now treated. I'm looking at you this way. So you can really see, if you want to point out anything, Brittany, feel free to kind of narrate what you're looking at there.
All we've done so far is just start to increase the vertical height of this side of the upper and lower lip. I'm going to go back in and add volume horizontally as well.
Okay.
And there may be some areas where I'm still going to pull up and increase more.
Okay.
Like I said, this is a step-by-step process. So we'll probably use about half a syringe on her today, and then 2 weeks later, add the remaining and increase the height even more.
Okay. All right. Very good. Sorry. Thank you, Kayla. There's your
So
sit-up exercise for the day.
We're going to do just a little bit of volume before I move to the other side. So slight open of the mouth. And then you're going to feel a little poke. Little poke. And Kayla probably is the most perfect patient. She does not flinch at all. in a while.
Yeah.
The lip's a sensitive area, so Kayla agrees. But it's not tolerable and it's completely worth the results.
Cream definitely helps.
Slight open of the mouth, perfect. So going in horizontally, I'm actually doing a retrograde technique. So the filler is actually being pulled in when the needle is being pulled out. I am aspirating prior to injecting. It's just one of the many ways that we can avoid any type of filler complications like occlusions or vascular compression. So if you see me draw back on my needle prior to injecting or why I'm hesitating before pulling the needle out, I'm just taking that minute to ensure the patient's safety prior to injecting the filler.
So before you stick Kayla again, we have a question for Kayla. On a scale of 1 to 10, how much pain does she feel with the numbing cream?
Honestly, from a scale of 1 to 10, I would say it's about a 4 or 5.
4 or 5. Okay. All right. I think you're tough, but thanks for that. It is a good numbing cream. It truly is. It is.
And I've had my lips done, and numbing cream wasn't the greatest, so this is by far the best.
Good. Glad to hear it. Susan, all you got to do is give us a call, and we will get them done. Brittany will be more than happy to create a masterpiece for you.
Yes. Now I'm actually gonna switch sides.
Okay. So we'll exchange.
Sorry about that.
Brittany, that some people come here and say, I want lips just like yours.
They do. And what I want them to understand is I actually did my own lips and it wasn't in one sitting. So I have a total of 2 syringes in my lips as well, and I did it over about 4 separate sittings.
So I'll give you a little look
So
of Brittany's.
it does take a little bit of time. You can't just expect to go in and I started with very thin lips. You can't expect to go in and then come out with full lips in one sitting. The tissue can only take so much filler, and in order to avoid the duck lip look that everybody comments on so frequently, adding a little bit of filler, giving time for the tissue to expand, and then adding more prevents that. And it can also prevent filler migration. You can only force so much filler in an area at a
So you're
time.
gonna tell me the one time I've had mine done and he put the whole syringe in at one time? That's usually a no-no?
I wouldn't say it's a no-no. It's not my injection style or technique per
Gotcha.
se. But there are people that come in with very, very beautiful full lips already that their tissue might be able to tolerate a full syringe in one sitting.
Okay.
It just depends. That's person by person. So just looking, I've added a little bit of volume in her upper and lower, as well as pulled out the side, so you can see the pretty significant difference between the left to the right side of the lip. And then if you want to come and look up close, so we've only done the left so far.
What a difference.
Mm-hmm.
You should be. It was great.
So now we're going to start working on the other side, and we will absolutely make sure that y'all get the after photos too.
You know, one thing I think I'd like to say here is you brought up the comment about the duck lips, and
Yes.
certainly we get that often. And most people, that's what they're trying to avoid, is that look. And I think that what is really good about what Brittany was explaining here for everyone is there is lots of people who want a very full, pouty, voluptuous lip, and Kayla's one of them. She wants that look, but that doesn't mean she wants to look fake and duck-like. And that is where having a skilled injector with real talent comes into play, because if you don't know how to do that in the stages that, as Brittany was describing, by not doing it all at once and going at this and building a border out if need be and so forth, it's really important to have that right technique so that you can have the bigger lips that still have a natural shape and appearance to them. So
You have to trust your injector and also have a little bit of patience in order to reach your goals, because at the end of the day, you want your lips to look amazing. So waiting an additional 2 weeks to add a little bit more filler is completely worth it. versus putting it all in at once, in my opinion. Sorry, that does mean that you have to go through the poking more than once. So now y'all are starting to see that full bottom lip growing.
What I love to see is how the border starts to take this really pretty shape.
It is.
You know, it's what we try to create with lipstick, right?
Yeah,
Except
exactly.
it's
And you
just
do the liner and the lipstick.
yeah,
and,
uh-huh, yep.
And I like that y'all get to see the full process because the blood and the swelling, I mean, it is real.
Right. Gotta see the side too.
Mm-hmm.
Can you see?
Getting a better idea of exactly what you're coming in for.
Exactly. So you can eat normally.
Eat normally, yes, but I want you to avoid like drinking from straws. So anything that you're forcing a pucker,
No kissing.
light kissing is fine.
Well, it's a good
A
question.
little-
It's a
little
good
pet.
question. You don't want to be, you know,
That is true.
doing a serious makeout session
Like open up your
and
mouth
some
then
other
upper lip.
things that would cause you to pucker your lips are not going to be a good idea for a while. So plan ahead.
Gotta go there. Gotta go there.
You know, it really is part of our post instructions, and we do have to talk about it because
Is it really?
I gently try to encourage people to realize what I'm saying. You know, when we talk about that in the instructions, because obviously we want to be professional about it, but it's what a terrible thing if you
Good.
undid all of what you just went through,
Right.
particularly the migrating into an area you don't want it. So that would not be good.
No.
We don't want that.
No. So ladies, just don't tell your husbands and tell them afterwards once
Right.
you get home so they can't try and talk you out of it.
That's funny.
That's my best advice.
So, speaking of husbands, I was talking to somebody today who the husband was not supportive of this type of treatment, and she almost didn't do it. She ended up doing it, loved her lips. They were so natural looking, and the end result was, sorry for any men who might be on here, but it's the truth. He had no idea she had filled her lips, but kept commenting on how pretty she looked.
Aw.
So he had no clue that she had done the thing he asked her not to do, but commented on how pretty she looked. And so, but I think that speaks to when you have
So
a
many.
natural
Yeah.
lip
Yeah.
enhancement done, it's so natural that you just look better, but it's not, like,
It's not overdone.
yeah, it's not overdone. Yeah,
Everybody has different lip goals.
for
and
sure. Yeah.
We can provide that. Sorry, I'm
You
moving this
switch.
a little more. Nope.
Oh, okay.
I'm just.
How you doing,
I'm
Kayla?
good. Like I said, it's just reaction for me to cry, so
That's okay.
it's
Well,
not that bad.
All those people watching are like, oh, I sure hope so.
I promise. It's just a reaction.
it is.
like
It is
how-
just body's reaction. It's like pulling a nose hair.
Mhm.
Yeah.
Reiterate the straw usage as far as how long do you,
I request a week.
at least a week, but you
2
prefer
weeks
to?
preferably.
It's hard. It's hard. I'm a straw person myself, and
Yes,
I
I'm being
found-
asked that question right now by
I
my
still-
daughter.
I still used a
See there?
straw, but I was just very, very careful not to push my lips when I did it. So,
So after that time, you're okay to do.
yes.
Okay. It's
So
like it's not gonna
if we're
happen.
really talking about a straw, you actually can kind of put it in the corner of your mouth over here,
And be very
and
gentle.
then you can actually close down on it and drink through it without pursing your lips.
Yes.
Yeah.
My biggest request is at least a week. was trying to help you. If y'all didn't catch that, I was side wiping a tear for her. All right, give her a little poke.
Making progress, Kayla.
So you said it can take up to hour and a half
For what?
for building. I mean,
No, I would. It
Well,
can-
from start to finish it may, because we have numbing time
Yeah.
in there,
Oh,
so we
okay,
want you to
okay.
numb for about 30 minutes.
okay.
Sorry, I'm
and
turning
I'm
around
going
looking
a
at the
lot
people in the room.
slower just because we're videoing. But generally, it takes me around 30 minutes to inject, but I want you to numb for a good 20
Yeah.
because the lips are a more sensitive area.
Yeah.
So depending how much we're actually doing and if you need a lot of vertical height versus just volume, then you may be poked a lot more than someone else.
Lucky you,
Kayla
Kayla.
is wanting a lot done, so she is getting more pokes than your average person. All right, my dear. This one is a little pinchy. But she's wanting that Cupid's bow. Little poke.
It's hard to look.
What other questions do we have, guys?
I have one. Like some people, like it, for me, I will have no idea to tell you.
Mhm.
Like I don't understand anything about lips. Like a lot of people do like that. So how do you get exactly?
What looks good?
Yeah.
If you're not sure how to describe it, bring me photos. Show me some before and afters, and you can even Google before and after on lip filler. Or if you have a favorite person, the way that their lips look, it will give me an idea of the shape, the amount of volume, the size that you're looking for. It may not be able to be accomplished in one sitting, but we can get you to those goals if you're willing to be patient.
Okay. Cool. Kayla knew exactly what she wants.
Yes. And we're working her to her goals. So she had smaller lips starting out with, so we've already done one syringe of filler, and now we're working on the second one. Now it's gonna make me need a little bit more volume too.
Well, this is what happens. I'm just going to be honest. Every time someone comes out of the room, what do I say? I go, I want what she had. What she had. I want what she had. I'm doing it all the time.
She has really great pictures of before and afters on her Instagram.
Yes.
She really does. And it gives you kind of an idea of what, like you said, what you might like.
Y'all definitely can look me up on Instagram. I do post a lot of photos, and then they also share them on the Pura Vida Facebook page and Instagram as well. So definitely go ahead and like those pages so you can keep up with everything that's going on here. We offer a lot of services and a lot of specials. Go ahead and smile for me and pucker and relax. So I will have you make some facial expressions while you're being injected, and the reason being, even though it feels a little funny because of the lidocaine, you do have some slight distortment. It allows me to see if you're lacking volume or shape anywhere, because we make a lot of facial expressions. So we want to make sure that that volume is even. All right, guys, so for Miss Kayla, this is actually gonna be my stopping point on her for today. I'm gonna allow the swelling to go down and the tissue to expand to this filler a little bit more. And then we'll go back in about 2 weeks and do some minor details on her and touch-ups.
Okay.
I'll let you get a close up now then.
I was gonna say maybe sitting up. You want to bring her
Yeah.
chair up, and we'll try to get a good look at those new lips. All right. Look at all the people. She sits up, and everyone's staring at her. Those are the new and improved.
Wow.
Wow, they look really
Wow.
good, Kayla. Let her see a mirror.
Just like the
Give her. Where's the mirror? Let's see her reaction. Where's her mirror? Right
It
there.
is behind.
Yeah. The other one, the big one. Describe her the big one. Yeah. For now. What do you think?
Ooh.
like, here, just like this one.
They look really good.
Uh-huh.
Yeah. I'm gonna get a little bit from the side. Yeah. Oh, they look so good. Even from this side profile.
I
Really
don't know.
good.
I mean,
Yeah.
I don't know, but do you feel
Wanna
anything
come all the way
different?
around?
No,
I'm
not
just
yet.
numb right now.
The lidocaine kind of
Mm-hmm.
takes away from anything that you're feeling. It almost feels like you went to the dentist distorted feeling.
Oh.
Okay. Well, so we are complete, at least at this point.
Yes,
And we'll see Kayla back in about 2 weeks.
exactly.
Okay. And I don't see any more questions that came up. I'm going to kind of scroll back real quick and just see. I think I got all of the answers to those who were watching live. I'm not seeing any I missed. So we'll be signing off. Thanks for everyone who attended. We will be back here tomorrow noon time with Brittany, who's going to show us what doing a lip flip looks like. So using a neurotoxin like Botox to make the lip look more full without dermal fillers, and she can explain how that technique works. And we'll do that tomorrow at noon.
Yes.
And then tomorrow at 4, Brittany and I will be having a sit-down roundtable discussion about health and wellness, to include information about our IV vitamin therapy here, as well as weight loss, as well as what is becoming super popular, our skinny shots, and what else? I think that's about the 3 topics we'll be talking about then, okay? So thank you, Brittany, so much for doing this for us today, and thanks for those who were in attendance, both online and here in person. Have a good night, everybody. Bye-bye.
guys.
Bye.